Good morning. My name is Peter Pepelugiski, and I will be discussing my literature review regarding the visualization in endodontics. Endodontics is a specialization in dentistry focused on dental pulp, the tooth root, and the surrounding tissue. They commonly treat cracked and decaying teeth and dental trauma, but primarily deal with root canal therapy, abbreviated RCT. This area has been riddled with musculoskeletal disorders and has greatly benefited from advances over the past 15 years. New technologies and optical aids have caused improvements in ergonomic concerns and surgical precision. As previously mentioned, root canal therapy is a pretty common procedure. By discussing the optical tools for RCT, it will serve as an overview of the ergonomic gaps and solutions for endodontists due to its high prevalence. When there is a threatened tooth in need of RCT, inflammation or infection may already be present. The first step is to drill into the pulp chamber of the tooth and remove the infected region. Next, the root canal's nerve is removed by drilling, and then the tooth is filled using an inert material such as gutta percha. Finally, the endodontist seals the tooth and with the removal of the nerve and blood supply, fits a crown. As you can see, there's a diagram detailing the steps on the bottom of the slide. Due to advances in visual aids, root canals have gone from being a 3-day procedure to a 1-day, 1 to 2 hour visit. This can be attributed primarily to tools that allow magnification 4 to 25 times the human eye. This has resulted in increased speed and efficiency of the endodontist in respect to more precise motions and less errors. In addition, the patient benefits from less pain occurring. Prior to optical aid advances, endodontists only had their eyes. Notable gaps were inefficiency in handling the instrument due to excessive motions and using tools for unattended purposes. Furthermore, high muscle tension and physical load was the result of having to use the tools in awkward positions for prolonged periods of time. Ultimately, these gaps are a result of the overarching poor visualization of the surgical area. The solution to these gaps came in the form of advances in magnification and visualization technologies over the past 15 years. Primarily loupes, as seen in the picture to the right, and operating microscopes. These two tools address technical issues as well as ergonomic ones, resulting in their quick adoption. MSDs are alarmingly prevalent in this area, with 65% or more of international endodontists reporting pain primarily in the back and neck areas. The risk factors for this pain is from static and awkward positions such as slouching over and craning one's neck. As you can see in the picture, the spine is in an extremely strenuous position that puts heavy load that can lead to serious complications after prolonged periods. Loupes are devices attached to the glasses that increase magnification of the surgical area that have resulted in the benefits of increased speed, accuracy, and efficiency. However, they did little to alleviate most MSD concerns. However, some fatigue issues were resolved, such as reducing hand movements from being more precise and accurate, as well as a reduction in time in awkward positions. Recent research has shown that sitting upright helped reduce MSD complaints after a 4-week period, but as seen on the previous slide, keeping the back straight in a surgery would be rather difficult to achieve. A bigger advancement came in the form of the operating microscope. As demonstrated in the image, the spine is kept in the correct position and there's proper back posture. The awkward arm motion of resting the arm on the leg was reduced, as seen in the previous image, and concerns about depth perception are mediated by tactile feedback so that accuracy is not compromised. This instrument addresses one of the two primary areas of MSD complaints, notably the back. While loops were a good intermediate solution for the aforementioned gaps, based on my literature review, the Carl Zeiss operating microscope seems to be the best recommendation for endodontists. As we saw, it will address the back concern, but it also addresses the other major concern, which is pain in the neck. The ability to adjust the scope, as seen in the picture, essentially widens the field of view and prevents the need to crane or awkwardly position one's neck. By addressing the major MSD complaints as well as the technical needs of appropriately visualizing the surgical area, the Carl Zeiss operating microscope appears to be the clear solution. Thank you for your time today. I can field any questions you might have now.